Welcome! In this video, we will talk about physiotherapy techniques to improve proprioception in patients with cerebellar ataxia. We will begin by explaining the theoretical basis of the application of physiotherapy techniques to improve proprioception in these patients. First of all, we have to take into account that the aim is not to train strength or endurance, but to improve proprioception to obtain smoother and more controlled movements. We can use both weights and elastic bands. Regarding the first, we can use weights placed distally on the limbs. And we can also introduce weights into a vest. Specifically, it is recommended to place them at the umbilical level, since due to their proximity to the center of gravity, they will exert their stabilizing function. Placing weights seeks to promote stability through compression of the joints and provide greater proprioceptive information. Although scientific studies differ on weight distribution and quantity, the general recommendation is to use less than 2% of total body weight. On the other hand, elastic bands can also be placed on the upper and lower limbs with the same objective, promoting stability through compression of the joints and providing greater proprioceptive information. We will now show how to place the elastic band on upper and lower limbs. We will place the elastic band under the foot, considering that there must be the same length of band on each side. And from here we will make a cross in front of the ankle, another behind the knee, and another in front of the thigh. And we will tie the band with a knot to the patient's belt, closing the circuit of the elastic band. We are now going to show 3 exercises with and without the mentioned materials. The first exercise is for the upper limb. In this exercise, the patient is seated in front of a panel with numbers that are within reach. We present the exercise to the patient and assist its performance. The patient performs the exercise independently. Now he performs a movement with a weight. And now the patient performs a movement with the elastic band. The patient repeats the exercise with the right upper limb. The second exercise is for the lower limb. It involves indicating with the tip of the foot 3 distances that have been previously marked on the ground with tape. Firstly, the physiotherapist presents the exercise to the patient, who performs it with assistance. Now, the patient performs it independently with the right lower limb. And thirdly, the patient performs the movement with the weights. Now, the patient performs the exercise with the elastic band. The patient repeats the exercise with the left lower limb. The third exercise is for gait training. First, we can observe the walking movements without the elastic band, and then with the elastic band. It is important to consider that the application of a proprioception element requires a period of familiarization in which the patient receives and manages the new information, so the specific application may not provide any improvement.